Hello everyone, Juxtaposition here. I'm trying out a new microphone today, so with the hopes that it will have better volume control for my listening audience, my loyal audience, which I appreciate. Um, I have had approximately 100,000 views so far this year. It's about 5 months of work, about 5 months, 5.5 months, and about 1% of the views subscribe to my channel, so that puts my subscribers at around 1,000 now. So that's exciting. A couple things I've learned in my journey, primarily over at the Google platform, which paradoxically they have the higher censorship. They practice censorship on that platform. They have no rhyme nor reason. There's no rules. Certainly, they don't know anything about information, and they don't know anything about disinformation over at Google at all. But yet they're driving the primary search engines for your searches, and they're controlling the content that's published and or deleted at YouTube. Of course, that was brought to you by Sequoia Capital and Don Valentine and Doug Leone. You know, the two knuckleheads that brought you FTX cryptocurrency debacle brought you Google. There would never be a Google, and there would never be a YouTube if it wasn't for Don Valentine from the Bronx and his cohort, Doug Leone, from the Bronx, Mount Vernon. And Don Valentine died a few years ago, a couple weeks after Aaron Valente died. Aaron Valente was a 33-year-old alumnus from Georgetown University in the swamp of Washington, D.C. Anyway, she was she worked at Summit Investment Partners down on Middleton Road in Menlo Park, and then she later, her boss became the managing director at one of the subsidiary entities at KKR, Jerome Kohlberg's company from the Bronx. Jerome Kohlberg's from New Rochelle, New York, and he moved out to California near Stanford University to Atherton in 1976. Anyway, he's also passed away, and so he's not in the story, but Doug Leone is, and he's worth over $6 billion. He could personally bail out all you cryptocurrency people that lost money, because the knucklehead private banker, remember, private banking means the concealment of sources and uses of money, right? So everybody on the news is talking about Sam Bankman-Fried and whether Caroline Ellison will cut a deal to testify against him in this terrific fraud that has engulfed, one of the television talking heads, Jim Cramer, formerly of Harvard University and Goldman Sachs, who was the pimp for FTX on CNBC. So it pretty much implicates CNBC as being a unreliable fake news company, right? Reliable fake news, but unreliable truthful news, right? And it also engulfed, Mr. Wonderful, I think they call him, the balding, genius that works with Mark Cuban over there on, I don't even know the name of their stupid show where they pretend to capitalize television-created entrepreneurs, right? Anyway, Mr. Wonderful apparently is getting lambasted in a little bit of the same way that Sam Bankman-Fried, soon to be French fried, Sam Bankman-Fried is going to be his name, not Fried. Anyway, Mr. Wonderful is, last I checked, he's not under federal indictment. Neither is Jim Cramer. But one wonders why not. I mean, they go on television and they pimp out a fraud. So in my way of thinking, they could be an accessory to a crime, right? Just in the way that Don Valentine and Doug Leone might have been an accessory to the murder of Aaron Valente, you think? I mean, she was last seen alive at 2500 Sand Hill Road, right? That's where Doug Leone parks his fancy car, at 2800 Sand Hill Road. It's the same parking lot. It's the same general parking lot. The top of Sand Hill Road next to Stanford University, that's right there. And, he's Mr. Big Shot. He's right there. Elizabeth Holmes is in that neighborhood. George Shultz was living in the neighborhood at the Hoover Institute. Sam Bankman-Fried's parents are law professors at the Stanford Law School. Even though we operate under Admiralty military law, what's to teach? What do you talk about? at the Stanford Law School. There's no due process. There's no common law. There's no law of the land. There's no United States Constitution. There's no Bill of Rights. What do you talk about? So that's a fraudulent scheme. Fraudulent scheme. Yale, Harvard, Stanford, Hastings Law School, aka University of California, Hastings, where Cackling Cacophony of Chaos, Camilla Harris, allegedly graduated. It's where I believe Joe Alioto graduated there too. Anyway, Dianne Feinstein graduated from Stanford. That's right. Dianne Goldman Feinstein. Not really sure what her real name is. But the point is that you're never going to hear Doug Leone's name mentioned, because part of private banking is the concealment of the people that are really involved in the funding of the FTX, because that was private banking. But I can tell you it's the same company, Sequoia Capital, that participated in Google and YouTube, which is in participating in the censorship business. All right, so today's talk's going to be on Medicare, where I have another, 10 years of experience with the so-called Medicaid and Medicare program, which covers 2/3 of all salaries paid to medical doctors, registered nurses, hospital administrators, controllers, chief financial officers, pathologists, ancillary support people like housekeeping, purchasing departments, radiology, MRI machines, capital improvements, computerized tomography, emergency rooms, routine, critical care, intensive care, surgical beds, and surgical suites is going to be 2/3 or more paid for by a federal centralized control bank-funded Medicare program. Make no mistake about that, people. That's bank-controlled healthcare. Okay, now the media likes to call it social medicine. It's not really social medicine at all. It's financial engineered medicine. And how do you get doctors to practice their craft? You pay them. And I was an assistant. I was an auditor. I was a assistant controller, a chief financial officer of an acute care hospital, and I audited dozens of hospitals, and I have audited dozens of Medicare and Medicaid cost reports, and which later were transitioned to a different mode of payment from cost-based reimbursement of hospitals to what was called prospective payments. But we all called them DRGs, Diagnostic Related Groupings. That's coding. That's coding. You know, just like do you have the secret code? DRG. Remember, everything with banks, everything with the CIA, everything with the military intelligence, everything with security clearances, like defense contractors, always uses acronyms to throw and snow the public. Like BISD. Bank Investment Securities Division, like CIA, Central Intelligence Agency, even though they conduct murder and assassinations. But they call themselves intelligence agencies. That's sort of deceptive, don't you think? Or let's say you call yourself PAVPAWS, when we really mean phased array vector evaluation and pulsing radio frequencies, right? Or direct energy weaponry, which has a whole host of acronyms because there's many different components that go into direct energy weaponization. Or the 5G mesh. There are dozens of acronyms to keep everybody completely clueless of how the internet actually works. And what does radio frequency in your microwave do to a bunny rabbit if you put it in there? And I'm here to tell you, it'll kill your bunny rabbit. So why do human beings think that they can be in a microwave, which would be called a smart grid, and behave differently than a bunny rabbit might in a microwave? Well, you know, maybe they didn't turn up the volume as high intensity, but they could, because you only need half a G to run your cell phone. You don't need 5G. 5G is a weapon system. Anyway, here's the deal, and it's going to be disturbing because we're in a war. This is a full-time war till your death, and I don't know if we're going to win the war or not, but you sure as heck should go down with the ship, because you're going to go down if you surrender. If you surrender, you're going to go down. Remember, the rule of maritime law is we follow orders or people die. But what they don't tell you in the movie A Few Good Men is if you follow orders, you may die. Yeah, if you follow orders, you could die. So if somebody tells you to go get an experimental bio jab, and I know 4 people who died in 2022, so they followed orders, but they died, so they're not part of the conversation anymore. And then I know quite a few people that didn't die, but are now injured. And they have high heart rates, they got inflammation, their doctor recommends. This is pathetic that I would know more about this than a medical doctor would be. Ibuprofen, and if that doesn't work, we'll use corticosteroids, like you're an athlete, because that's anti-inflammatory. But you need to continue your corticosteroid injections. And then if that doesn't work, we'll install a stent from my favorite pharmaceutical company that I signed a contract to. You only use the stents of that company exclusively. Because when you dig into delve into Medicare, and I'm familiar with the physician component as well as the hospital component, the Part A, Part B, right? There's the acute care facility, which hires the nurses and has beds for overnight stay, but does lots of treatments on an outpatient basis. But they have expensive equipment like MRI machines, which generally speaking, most physician groups do not own that kind of equipment. It's too expensive. Some do, and ophthalmologists own specialized ophthalmology so they can do cataract surgery in their office and keep the hospital out of their equation. But I'm telling you that the payment systems have changed and evolved since 1964. But they made a big change in 1982, 83, 84, when we went from a cost-based system to what's called DRGs, Diagnostic Related Groupings, where you pick codes. Now, at that time, there were 469 DRGs, 469. In other words, the McKinsey Consulting Group or the Boston Consulting Group, McKinsey and Company, or Bain and Company, got paid hundreds of millions of dollars to come up that there were only 469 things that you would need to stay overnight in a hospital for. And they ranked them based on intensity. Then they threw it into a computer and divided the costs of operating a hospital of 200 beds, 300, 400, 500, 600 to your like New York, Manhattan, size urban hospital. And they came out with sort of an average cost for urban acute care hospitals, and then they came out with an average cost for rural, which would be somewhere out in far away from an urban area, out in the rural part of East Washington State, or Boise, Idaho, or Wyoming, or Livingston, Montana, for example. That would be considered a non-SMSA area. They're standard metropolitan statistical areas, SMSA. That's another acronym that the military brings you, SMSA, Standard Metropolitan Statistical Area. So Medicare transformed itself into a prospective payment DRG, Diagnostic Related Coding, based on intensity, plus factoring in whether you're a SMSA urban hospital or you're a non-SMSA rural hospital, because the theory is that housing is cheaper and wages are lower, and so why would I pay a hospital in Livingston, Montana the same per patient per procedure that I would pay a Manhattan patient inpatient, or a Los Angeles inpatient, or a San Francisco at University of California, San Francisco overnight stay, right? All right, so you can guess how this goes, right? So if there's 469 things, justifications of why you would have to stay overnight, at least one night in a hospital, I can just tell you that they would all be ranked from top to bottom, from most intensive, requiring the most nursing care, the most pharmaceutical consumptions, the most attention in terms of lab testing from the pathologist team, the most radiology, MRI treatment, diagnoses, because everything in a hospital is about diagnosis. They run so many tests. or blood transfusions, or consumption of supplies, etc. Well, guess what happened when that program was rolled out, right? So there's 469. So you would think that once you roll it out, that patients would have, a random sampling of that. No, that's not what happened. Basically, the doctors who have reimbursement in a parallel method that the hospital does, in other words, they align the pathologist with the medical doctors, with the hospital administrators, to maximize reimbursement. Because if you're an employee working in this meta universe, because there's what's wrong with your patient, and then how do you get paid? And those two concepts, how do you get paid versus what's wrong with your patient, are totally disconnected. There's no correlation equals causation when it comes to doctors treating patients. None. They care about one thing and one thing only. How do I get paid the most for the least amount of time so I can go play golf or get the heck out of here because I hate my job? Because most medical doctors hate their jobs. They don't like their jobs. They don't like annoying patients that ask them a lot of questions. They don't like any questions at all. And the reason that they don't like any questions, just like investment advisors or bankers don't like questions, they don't know the answers. They don't know the answers. They went to Harvard, they went to Yale, they went to Stanford, they went to UC Berkeley, they went to UCLA. They didn't learn anything. They were indoctrinated. They were indoctrinated into an obedience and oath of secrecy code. So they didn't learn anything about medicine or finance or investments when they went and took their economics classes or their medical school memorize and repeat mythology classes. They didn't learn anything about clinical care at all. And they still don't know anything about clinical care. So if you're concerned about your health, you're the only one who is. You're the only person. Because Medicare, it turned out that 90% of all the DRGs were the two DRGs that had the highest payment reimbursement to the hospital and to the doctor, to the medical doctor, who had to get the approval of the pathologist because you run those tests. And then to validate your diagnosis, you have the test, but you only have that if the pathologist agrees. He agrees that that's what the test shows. So guess what? The highest paid people at a hospital normally was the hospital administrator, the chief financial officer, which I was. Those were the two highest paid jobs at an acute care hospital before 1982. The administrator and the chief financial officer. They were the most important person if you wanted to recarpet your lobby or put in marble. That was, you got to be really nice to the administrator and the CFO. After DRGs, Diagnostic Related Groupings, which are based mostly on what the pathologist agrees, the salary of the pathologist, which was already, good, quadrupled. So back in my day, in 1982, we had a pathologist who was making $175,000 a year. Now, he also moonlighted and had other income that I don't know about. But with respect to his 40 hours a week commitment to an acute care hospital, we paid him $175,000 a year. Over the next 2 years, as we rolled out the diagnostic related groupings, which he had to sign off to agree with the medical attending physician, his salary went up to $800,000 a year. So it went up more than 4 times because he's such an important person. Because see, if he doesn't agree that that's the more intense diagnosis, you see, then you're going to have to fall down the DRG tree to like number 362 or 322 or 222, room 222, where you're going to get half as much money. Instead of getting paid $25,000, maybe you're only going to get paid $12,000. See, people, this is exactly how doctors think. That's how administrators think, and that's how the pathologists think. So the new program, the new re-engineering of a centralized program of bank-funded, it's bank-funded because our United States of America is insolvent. We don't have any money to pay for Medicare. We don't have any money to pay Lockheed for their surveillance work either. So the banks lend the money through the purchasing of treasury bills. Now, they don't do it directly. They go through their hedge fund partner, who is a former employee of their bank. That way they want to continue to conceal the sources and uses of money. Just like the banks don't want you to think that they run the Medicare program. And I'm here to tell you to your face, the banks run the Medicare program, which means they control the diagnosis that you receive when you go see a medical doctor. A bank decides that, not the doctor. The doctor is just a chimpanzee. He's doing what he's trained to do, which is to get paid the most for the least amount of his personal time. I mean, that's what his motivation is. Get paid and get out. And that's what the pathologist is focused on. And that's what the administration and the executives at the hospital are oriented toward, maximizing reimbursement. They're always interested in maximizing the amount of money that they can collect from Medicare. But if the bank rigs it so that those payments default to certain procedures that may have nothing much to do with how sick you are, it's a fraudulent scheme. And I'm here to tell you that most of the work that's done at Medicare is fraudulent. It's flawed, it's inaccurate, it pays really well, but the participants in it are all, they don't really have a choice. It's either that or quit. Those are your choices. You could quit. You can try to get out. And then you're unemployable, because I'm here to tell you that if you went to medical school and you're not collecting any Medicare money, or you're not part of a medical practice that dominantly collects Medicare money, you could be a obstetrician, or you could be a pediatrician. You're not going to collect Medicare money. But you have to be part of a doctor group who does collect Medicare money, because that's most of the money that's available. That's most of the money available. There are many, many, young women who have babies that don't have health insurance. They would be covered under the state programs, which is called Medicaid. And the reason we call it Medicaid is it's 50% paid by the federal government, Medicare. So when we talk about state programs, remember, they've been completely co-opted and compromised, because the federal government, which means the bank, controls the Medicaid program too. So they control the Medicare program, which is for people mostly over age 65, who are primarily the people that go to see doctors. Okay? And then they control the poor people who don't have health insurance, and Medicare pays half of that. Then the county and the state can figure out how to pay the other half if it's an indigent person. All right? And then you have private health insurance, Blue Cross. By the way, Blue Cross manages Medicare, in case you didn't know. They subcontracted the financial engineering of Medicare is Blue Cross. So Blue Cross is essentially the government. And just to let you know what this all means, it means they're all vaxxed. They all have to be vaxxed, because if you work for a military contractor, or you work for the United States Coast Guard or Navy, you got to be vaxxed. And if you work in Medicare, you got to be vaxxed, because it's a federal mandate. And so all the people at Blue Cross got to be vaxxed. All the people that work in all the different subcomponents got to be vaxxed, which includes the doctors, the medical doctors. So that's a big, big, big conflict of interest, because I'm here to tell you at least half of the people who come to see doctors are not vaccinated. Now, what if you need a blood transfusion, right? Well, our blood supply is totally tainted now, because all it takes is 2 or 3% of our population to be vaccinated and have aluminum oxide in those blood supplies, and you're playing Russian roulette. You don't know what blood is what. So all the blood, I mean, and it looks like we have a third to half of America has taken the jab. And if that's the case, that means that the blood supply is completely contaminated. So God help you if you need to do a surgery where they're going to do a blood transfusion on you, because it means you're getting vaxxed against your will, right? And when you go to your doctor and they put you down on a sedative, I don't know if they put the aluminum parts into the anesthesia. I don't know. I know they're dumping chemtrails over my head. Today was another 36 chemtrails over my head day, and it's Wednesday. They typically do that on Saturday or Sunday. And now they're doing it midweek. And so it's starting to look like they're doing chemtrail dumping 7 days a week. And they're doing it at 10 times the rate that I used to know they did it before. Before a year ago, I thought they would do chemtrail dumpings, like 2 or 3 at a time. Now they're doing 24 to 36 over 3 hours. That's a fleet of military planes. Well, they're doing that with our blood supply through the Medicare program, which is a central controlled bank sponsored program. And someone is paying for those military planes overhead. And I've already established that the United States military can't afford to do that. So the banks are lending the money so that these military planes can dump aluminum oxide and barium and God knows what else over our reservoirs, our forests, our parks, our people, the dog walkers, breathing that stuff in. Your dog is breathing that in. Anyway, that's kind of what I wanted to tell you today is basically we're back in the Stone Age now, okay? Because we have no medical system. It's been completely and utterly co-opted, compromised. And I know of a particular case 2 weeks ago where a guy needed a liver transplant and they told him that unless he got vaccinated, they would not do it. So he agreed to get vaccinated. Then they told him he had to go on a waiting list, and they discharged him and booted him out of the hospital once they vaccinated him. In other words, under duress, with a gun to his head, when he needed a liver, a new liver, they told him to get vaccinated. Then they booted him out of the hospital. And it's been 2 weeks and they haven't called him back for his new liver. So I think they lied to him. I think they, just like when you sign a plea agreement, like Samuel Bankman-Fried is going to have to sign. He's going to sign a plea agreement. I don't think there's going to be a trial. And Doug Leone, see, you wouldn't be able to call Doug Leone as a witness, a material witness, right? Because there's not going to be a trial. So the public's not even going to know what Sequoia Capital does for a living, which they work really hard to conceal what they do for a living. But I already told you, they bring companies like Cisco Systems, LSI Logic, Google, YouTube, Zoom to life. FTX. For all I know, they might have been involved with Elizabeth Holmes. I have seen no information where Elizabeth Holmes got her money for Theranos, but she got tens of millions of dollars from somewhere near Sand Hill Road. And there's only two places you can get it. KK&R or Sequoia Capital, or down the hill, Summit Partners. Maybe they could kick her some money. But she's friends with Henry Kissinger. He's on the board of directors. Henry Kissinger and George Shultz are on her board, along with a former CIA director is on her board of Theranos. So again, she just was given an 11-year sentence for fraud, but I didn't see them arrest Henry Kissinger. He supervised her, and the head of CIA supervised her. How come the head of the CIA isn't arrested? Right? Where's Doug Leone in all this FTX crypto business? He's gone. He's missing. He's not even on the conversation. He lives in Atherton. He's real easy to find. All right, that's it for today, people, is that everybody's on their own. You're going to have to take care of yourself, and hopefully you won't need a blood transfusion. But this is where we're at. It's a full spectrum dominance. Your doctors are compromised. Unless they quit. If a doctor quits and asks you to bring eggs and bacon to his house in lieu of Medicare, maybe you could trust him. But as long as he's getting paid by a centralized bank-sponsored system called Medicare, you're never going to get a straight answer out of him. Plus, his education didn't really give him a chance to know what he's talking about. Thanks for listening. Take care. Bye-bye.